This is Kerri Wachter with Elsevier Global Medical News, reporting from the annual San Antonio Breast Cancer Symposium. Joining me is Dr. James Ingle of the Mayo Clinic, who presented the results of two meta-analyses showing lower risk of recurrence of breast cancer with aromatase inhibitors compared with tamoxifen. Can you tell us why the size of these two meta-analyses is important and useful in determining trends for these patients?
Yeah, the meta-analysis process is really important because it brings together the totality of the randomized clinical trials in both these settings. And what has been identified in the past is that this meta-analysis process allows us to gain more insights, more information than we could from any of the individual trials alone. Now, back when the Early Breast Cancer Trialists Collaborative Group was started, back in the mid-'80s, clinical trials were much smaller. Today, clinical trials are generally much larger. And the question is the overview process, the meta-analysis process, still relevant in this day and age? Well, we think it is relevant because there are many questions that many think can be addressed better by pooling the totality of the experience rather than just looking at individual trials. The key thing here is that globally, the investigators involved with these trials have really come together to support the process. And we hope in the future that we're going to be able to address additional questions. Again, that could be much better evaluated looking at the totality rather than individual studies. One example is overall survival. We need longer follow-up for that, but you're going to be able to get a better idea of an accurate estimate of the differences by bringing all the data together.
And on the subject of longer follow-up, we're going to gain more information by following these patients longer because presumably we may see some better survival effects from tamoxifen come into play?
Well, with respect to longer follow-up, we have the most experience with tamoxifen, and there's good data out to 15 years. If you look at the pattern of change in overall survival, that is, the studies that compare tamoxifen versus nothing, at 5 years there was an indication of improved survival, but it wasn't until we get out to 15 years that we saw the full value of tamoxifen, at least in terms of its effect on breast cancer mortality versus no treatment. Now, with the aromatase inhibitors, at this point in time, the follow-up is still relatively short. We don't have a lot of firm information beyond 5 years. So that's why it will be important that the follow-up continue so that we can give better answers to these important questions in the future. Because this information should allow doctors to understand the relative benefits of different approaches better than could be obtained from a single study alone.
This is Kerri Wachter with Elsevier Global Medical News in San Antonio.